All right, welcome to The Explainer. Today we are digging into a brand new 10-year plan for England's National Health Service. And let me tell you, it frames the future of the NHS as a massive, historic crossroad. And right from the get-go, the plan opens with this really powerful declaration. It sets the stage for what it calls a totally necessary radical transformation of the whole health service. Yeah, it really doesn't pull any punches. It basically states that the NHS is facing an existential crisis. The choice it presents is stark. Without fundamental reform, it risks becoming completely, and I mean completely, unsustainable. So how does it diagnose the problem? Well, it starts with some pretty stark figures. First up, this one, 7.4 million. That's the number of people currently on waiting lists for elective hospital care. Just wow. And it's not just about wait times. Public satisfaction, that's fallen too. A recent survey showed that more than a quarter of people, that's 1 in 4, had a poor experience just trying to book a GP appointment. So the takeaway from the plan's diagnosis is pretty direct, right? The message is crystal clear: change or bust. Now, the plan points to 4 huge trends that are really forcing this change. But what's interesting is how it frames them. It takes things like our aging population, new kinds of illnesses, our own higher expectations, and this incredible scientific revolution. And it says, look, these aren't just challenges, they are massive opportunities for reform. So what's the big idea? The plan's answer to all these challenges comes down to one single core purpose: to shift power away from the system, away from the state, and put it directly into your hands, the patient. But how are they going to do that? Well, the whole plan is built on 3 really radical shifts. First, moving care from the hospital out into the community. Second, shifting from an analog system to a digital one. And third, moving from just treating sickness to actively preventing it in the first place. Okay, let's dive into that first big shift, moving from hospital to community. This is all about getting away from a model where everything, and I mean everything, revolves around the big hospital, and instead bringing the NHS much, much closer to home. And you know, this is a really fundamental change in thinking. We're talking about shifting from a system where you have to travel to get care to one where care is actually designed around your local neighborhood and comes directly to you. This whole idea directly tackles the kind of frustration so many people feel right now. The plan even includes personal stories, like this one from a man named Mohammed. He talks about the journey with his mother's dementia and just captures that feeling of confusion. Who's supposed to help? Who's in charge? So the core proposal to make this happen is to create what they're calling neighborhood health centers. You can think of them as local one-stop shops for all kinds of care. They'd have extended hours, a whole team of different professionals. And get this, the ultimate aim is to basically end hospital outpatient appointments as we know them. All right, let's move on to the second big shift. We're going to see how technology builds on that idea of local care by putting control literally right into your hands. And the goal here is, well, it's ambitious. The plan itself calls the NHS a 20th century technological laggard. The vision is to transform it into one of the most digitally accessible health systems in the entire world. The absolute bedrock of this whole digital transformation is something called the single patient record. This would give every single person one secure account with all of their health data in one place. You could see it, your doctors could see it. It would essentially act like a patient passport you can use anywhere in the NHS. And that single record would then power a totally redesigned NHS app. The vision for this thing is basically a doctor in your pocket, putting a whole new suite of powerful tools right at your fingertips. And the vision for this app is just sweeping. You've got My NHS GP for AI-powered advice, My Choices to let you search and compare different providers. You could even self-refer to specialists or securely help manage the care of a loved one. It's a huge shift. Okay, on to the final shift, and this one is maybe the most profound of all. It's about moving the entire focus of the NHS away from just treating sickness to actively trying to prevent it from ever happening in the first place. A massive part of this is creating a new genomic service for the whole population. The vision is to shift from our current model, which is pretty reactive, right? We treat symptoms after they appear. The goal is to move to a model that's predictive, even preemptive, using things like genomic testing to understand a person's health risks right from birth. And the ultimate prize for this whole shift towards prevention, it's about tackling one of the country's most stubborn injustices, health inequality. The plan sets a really clear, bold target to have the gap in healthy life expectancy between the richest and the poorest parts of England. So, the big question, right? How on earth is all of this actually going to happen? Well, the plan says it all comes down to two critical engines that will power these reforms: the NHS workforce and a new approach to innovation. Because let's be honest, none of this works without the staff. And the plan directly confronts what it calls a deep morale crisis. It even quotes frontline workers, like a resident doctor named Nathan, who says he feels they're not valued, not trained, just treated like numbers on a road. The proposed solution is a new deal for the entire workforce. The goal is pretty simple, but powerful: to make the NHS the country's best employer, not just its biggest one. And that means a huge focus on better training, modern tools, and way more flexibility. And then there's innovation. The plan makes 5 really big bets on the key technologies it believes will drive the future of healthcare. We're talking about data, artificial intelligence, genomics, wearables, and even robotics. So when you boil it all down, the ultimate promise of this plan, to you, the patient, is actually pretty simple. It's about an NHS that gives you real choices, faster responses, and a genuine say in how and where you get your care. So, in the end, what we have here is a really bold vision for an NHS that's more local, more digital, and more focused on prevention. An NHS that is, in its own words, controlled by patients. Which, leaves us with a final thought to chew on. What would that future, a future where you're in control, what would that really look like to you?